What's up, GERO 200? All right, so we are powering through this stuff, and I'm sitting in the living room, which is okay. I'm changing it up a little bit. You can see my wife and my two boys in the background, right? So today is Tuesday, June 16th. Okay, so uh, just some highlights. Okay, bookkeeping. Don't forget that the midterm, of course, is due this week. So please get in there and get it done. Best way to do this is to open up the browser multiple times. So open up um, your um, weekly assignments, and then and then have a second browser open for the midterm. That way you can kind of go back and forth. Okay, no stress express, guys. You guys have got to have this wired. So I'm going to go into the weekly assignments. Do keep your eyes, of course, on the prize of June 22nd, and I'll be sending out a how-to video for that as well. All right? Awesome. Very cool. All right, so we're going to go right into today's work. Okay, so we are now kind of branching away from biology. I know biology is not your forte, but it's really good to be exposed to all this. So we're going to go kind of a branch between mental health, which is a combination of psychology and biology. We'll get in a little bit into the biology of Alzheimer's, but these diseases that we've gone through, um, cancer, which is right up here, um, diabetes, metabolic syndrome, which is a whole slew of things related to diabetes, including heart disease, stroke, kidney disease, and and then now we're going into mental health problems. Now, I want you to remember diabetes. Okay, this metabolic syndrome is kind of the scourge of Western society, sadly, where we don't have to work so hard for our food, where food is in excess, and um, and then you got to ask yourself, especially in today's climate, access to healthcare. So how do you manage your diabetes? Because if you don't manage your diabetes, then you setting yourself up later in life for having Alzheimer's disease. And it's the reality of it. If we look at the millions of people who have Alzheimer's disease, 80% of them have diabetes. So if we could just get in there and prevent and help people from having diabetes, then we're going to prevent people from getting these problems. Okay, we already saw there was heart disease was a problem, and Alzheimer's is a new problem. All right, so this is where the video is going to go right here. Okay, and so what we're going to do is we're going to just kind of review through things. Again, I always throw the PDF file up here. My preference is because it's nicer is to go into the actual URL of the website. And so we're looking at the obviously the growing mental and behavioral health concerns facing older Americans. This is multi-pronged. Okay, um, the reality is we do see cognitive decline when we get older. We have cumulative disease conditions as we get older, um, and it can wear on you, and it can put you at risk for not only dementia, but for psychological disorders like clinical depression. And certainly, I've gone through this where I was an athlete my whole life, and then sadly, I'm going to be 64 here in about 10 days or so. Um, the wear and tear on your joints and the surgeries I've had to have. I had shoulder surgery this year. I had total knee replacement. I've had back surgery, all related to um, being an athlete and having injuries. You repair the injury in your 20s and 30s, like I did, but however, that's um, the ball rolling for arthritis to step in, and then you have to surgically go in and repair that arthritis, but you don't heal as well or as quickly when you're older. And so it starts to mess with your head. It really does, because you don't ever want to stop being that person that you were. I was a really good surfer. I surfed the world, surfed Pipeline, I surfed Tavarua multiple times. These are all very great places. You have to be at the top of your athletic game and suddenly something that gets taken away from you. So that's hard. But let's look at some of the statistics. All right. So when we look at what's called severe, okay, disabling clinical depression, um, it's peaking in your age group, okay, and it has a lot to do with the developmental biology, right? You're going through puberty and how late the front of your brain undergoes full development. It doesn't get fully developed till you're approximately 30 years of age. Okay, and there's a lot of pressure. You're out on your own for the first time. Uh, you got to succeed. So there's a lot of pressure. Right? When we look as you get older, we see here that 20 roughly in this, and we'll see differences in statistics. It all depends on the study. But around 20% of people over the age of 55 suffer from some type of mental disorder. Okay, we look 2/3 of nursing home residents exhibit major problem. Okay, and you know it is environmental. I mean, it's the biology that underlies the depression, but we all want to age in place. Live in a beautiful home, hang out with our friends, and now you're stuck in a nursing facility. You you keep going, but there's hardly where you saw yourself in the end. And so it creates a psychological component to depression that then self fulfills into furthering the biological underpinnings of the depression. So, and yeah, it's tough. It's tough. It's tough. Okay. All right. There's less access to healthcare, and as you'll see later on in this particular article, we don't have very many people specializing in geriatrics, in specialized geriatric psychiatry or psychology. Okay. All righty. So you just kind of go through this and you think about this, okay? And yeah, as you get older, there's lots of fear, there's stress, anger. All these things influence um, your psychological well-being, and then they also influence your physiological well-being. This is kind of what's called the mind-body connection, okay? Where from high levels of stress, it causes decreased immune function. So you get sick more often. When you do get sick, you get slayed. Um, uh, because of that, okay, the stress also messes with the inflammatory response, and it's going to totally screw with your cardiac functions and other problems. Okay, all righty. Um, don't forget, you know, that we have an issue in this country in terms of funding mental health services. It's really hard to find psychiatric help. Just in my neighborhood, there's hardly any psychiatrists. Many of them don't take Medicare. Many of them don't even take insurance. So it's a tough situation. We got to improve that. There's so many ways that we can improve in our society. When we look at a consequence of clinical depression, um, the likelihood of suicide dramatically increases. Okay, so you guys are more likely to have severe depression, but older people are more likely to cash it in and commit suicide. Okay, and when we look at it, it's a male thing. Okay, it's still our testosterone because suicide is a very violent act, and so men are much more likely to do it. And yeah, so we look at again, we see 30% of nursing home residents suffering from depression, right? And again, this is a condition that leads to suicide. I don't have any value. I don't feel like I have any worth. I don't see any reason. Okay, and so there's a lot of psychological support that is needed. Right? Even though older Americans um, make up 13% of the population, they account for 20% of suicides. All righty. Another part of mental health is the cognitive decline. Right? Um, Depression is manageable. Depression is somewhat reversible. Cognitive behavioral therapy, social support, and there are pharmacological agents that can take the edge off that work pretty well. There's no drugs that don't have side effects. So there are side effects. There's no free lunch. Alrighty. Alzheimer's. Okay. This one is really troubling because what we do in the world is we we allow you to survive. So we treat your underlying infectious diseases. We then can surgically repair your torn ligaments. We can go in there and do a bypass surgery on your heart. We can manage your diabetes. Okay, we'll keep you alive. But in the end, we have this deterioration. Okay, where the biggest risk factor is getting old. All right. So we see in this particular example, it says 7% of the age of over 65. I'll show you a later statistic that says 10%. Um, and then roughly 1/3 of people over age 85 have dementia. And that's a tough one. That's a tough one, right? Because you've then become completely dependent, right? And dependent on you guys, all right? So it'll be, your older brothers and sisters of the millennial generation, and then you guys, Gen Zs, are going to, forced to step up, and either you do it at an individual basis for you, where there's a cost for you, or you tap into your financial resources. So one is a kind of a emotional and financial cost because you're not working if you're doing the caregiving. The other is just a serious um, financial costs. Care for an Alzheimer's patient can be $80,000 a year. Um, Home health aid can be $400 a day. So these are mind-boggling costs. Okay, alrighty. Um, Due to social isolation, that happens. Okay, not the kind we're experiencing right now with the COVID-19 pandemic, but social isolation that happens because children move away, spouses die, friends move and die, and so a lot of older people turn to alcohol abuse or other types of substance abuse. And again, this only makes things worse. Okay, it puts you at higher risk for other diseases, higher risk for dementia. Um, so this is why maintaining social support is so important. The number one predictor of of longevity, a long life, and not just a long life, but a fulfilling long life, is your social support. And it's not the number, but it's the quality of your social support. All righty. So things that drive these disease conditions, okay, chronic diseases, okay. Like I said, I have significant arthritis. A lot of people have hypertension, okay, um, and all these are going to contribute to people's well-being. These are not fun things, you know, to have to deal with. All right. Um, so what we need is we need more people to specialize in gerontology and psychology, gerontology and psychiatry, right? And that's clear. All right, so that's what that's all about, right? We then ask you from there, okay, to go in and learn more about Alzheimer's disease, okay? And so we can go in, this is the Alzheimer's fact sheet right here, okay? Um, and you just kind of go into the website and kind of navigate. Now the website changes, but I think you get the concept of navigating things. Okay, what I want you to do is I just want you to go through here and and click on this. How does Alzheimer's affect the brain? It just takes you. It's just reading to another part. So we see this massive degeneration. It starts in the memory centers. Okay, signs and symptoms. You familiarize it. Okay, I keep talking about cognition, which is being able to uh, understand and perceive your external world, to compare it with your life history, which is your memories, and so these cognitive abilities are really, really difficult. You'll see lapses in word finding. You'll find the older person getting lost easily, so visual, spatial issues. Okay, um, they don't make sense, on and on and on. So just kind of sift through this for me. All right. Um, there are different stages of Alzheimer's. Sadly, we don't have a blood test. The only way we can diagnose Alzheimer's is we diagnose it as dementia. There's a lot of things that can contribute to dementia. We can do a biopsy, um, a pathological report once you're dead to say, yes, this is Alzheimer's. Right now, we have to rely on a mini mental status exam. This is a psychological battery test. The other thing we can do is imaging, but it's very costly and it really doesn't change the course of the disease. Imaging says, yes, you've lost brain matter. Okay. The most expensive one is a PET scan where we can actually look at molecules, amyloid plaques, and um, hyperphosphorylated tau. These are the tangles that's only done in clinical studies, though, because it's so costly. Right? So these are some videos right here that talk about the basics of Alzheimer's disease. Again, we tell you right here how we diagnose it. You diagnose it as more of a neurologist slash psychologist slash psychiatrist, excuse me, that does the workup. You can do brain scans, but they're really, really, really expensive, and it's only done um, at usually at a clinical trial type of setup where we're testing new drugs and we want to monitor it. It doesn't. It's not on a day-to-day basis kind of thing that you would do. So that's when we start talking about clinical trials right here. Alrighty, we have horrible medication, right? That barely treat the symptoms. They do not treat the underlying reason for the brain dying off, right? So these are, they're called cholinergics right here, okay? And what they do is they help turn up the volume of the degenerating brain a little bit, but it doesn't stop it, all right? It doesn't slow the course of the disease. Um, this one right here, memantine, was hopeful, but again, it really didn't slow the course of the disease. It's a different type of drug that was supposed to stop the degeneration um, by decreasing the kind of toxicity that happens, but it didn't work. All right. Anyway, so yeah, and then the last thing is caregivers, okay? And that's a big part of what we want you to consider is not only, the biology. So you can go in here and this talks about the biology, okay? These are the statistics, so I'm not going to watch these videos for you. You watch it. So this was the one that was in there. This talks about the plaques and the tangles. It's related to a breakdown in the blood vessels in the brain that happens with diabetes, okay? Inflammation, all these topics you hear about. Um, and this is the kind of this is called epidemiology, where we look at the numbers and the shocking financial consequences. Alrighty, so we did talk about depression. Like I said, you guys, in terms of the onset, okay, of depression, it's it happens with brain development. We see this right here, okay. Um, but in terms of severity of depression, it happens at a much older age, okay. And we're looking here at statistics of rates of suicides by males, and you see it's pretty steady. It's been pretty steady for a long time, 1999 to 2014, all right. And we see that it's age related, all right, and it's because of the loss of social support, okay, feeling social isolation. We ask again by gender, and you see that this is a male dominated um, uh, outcome of being severely clinically depressed and having we're looking at suicide rates. And we see there is differences also in terms of ethnicity. Okay? So this is female, this is male, and these are the different ethnic groups. Okay, we see down here American Indian, Alaskan Native at the top, followed by whites, Hispanics, blacks, Asian Pacific Islanders. Okay, alrighty. So again, this goes over the demographics. Okay, um, we're looking here at so that was depression. Now we're looking here at Alzheimer's. So we're changing gears again. Um, Ask yourself what's going on. You know, why um, 2/3 of Americans with Alzheimer's are women. Women live longer than men. Right? That's a key feature. So the greatest risk factor for Alzheimer's is age. Okay. Um, Secondarily, the loss of estrogen with menopause is a risk factor. Okay, so it's a double whammy. We asked ourselves why are African Americans twice as more likely, okay, to have Alzheimer's. And this is where we say we look at 100 people, right? And you ask yourself about healthcare, okay? The inequities of healthcare and the fact that African Americans as a millions and millions of people population, just like white Americans, millions and millions of people of population are less likely to have adequate management of their diabetes. Okay, and diabetes is the biggest risk factor. Okay, so 80% of Alzheimer's patients have diabetes. Right, cardiovascular disease, all these things are risk factors, but mostly diabetes. Hispanics are much more likely to be diabetic, okay, than um, than whites. So that increases their risk factor. All righty, we see here again, bump up. So we see this prevalence per 100, right? So we look at 100 people, you see women, more women have Alzheimer's, right? So not only do they survive longer, but when we look at 100 people, something is putting women at higher risk, okay? And it's the loss of estrogen. Okay, these are uh, the same statistics we looked at. The costs, you know, in 2020 dollars are astronomical, right? Um, the cost to you as an individual doing the caregiving is significant. Okay, these are all the different types of problems that you're going to experience in terms of being a caregiver. You just eye that, all right? So there's a quick review of the cost to you, to your older brothers and sisters. Okay, when you have to care for your parents and grandparents, all right? And then this is an amazing example of shows somebody with severe dementia with Alzheimer's disease, and it illustrates the kind of care you would get in a skilled nursing facility, where music at least gives kind of an ray of hope. All right, so then what we want you to do here is think about this, think about your future, and think about how you want to change things so that the um, cost to you as an individual and society can be minimized, because it's a big deal. All right. All right. So that's it for today. Don't forget to get your midterm done. Okay, guys. And I think I'll see you next time.